access this meeting later, or you can reference it later. Hopefully, did everyone get the recording message? Did that pop up? Yes. Okay, cool. So, welcome to our October General Coalition meeting. I'm pretty sure I've spoken to everyone on the call individually before, but in case you don't know me, I'm Nandini, the director of our NorCal Coalition for Social Connection, and it's great to have you here. So quickly to run through our meeting agenda, I'll give a few updates on our coalition, and then we'll be joined by Amanda Spott from CESIL, which is a coalition to end social isolation and loneliness, and Healthsperien, who's going to give us a presentation on policy updates and what our coalition can be doing to influence policy and spread awareness. And then we'll have some time for discussion. I really want this to be a collaborative meeting where, I have some ideas for how we can go about doing these things, but I really want to hear from you as well and what you're interested in working on. And then we'll have a moment for some feedback at the end. So a few brief updates. We had our first coalition coffee chat on October 17th of this month, and we gathered to discuss how to engage hard to reach populations in our work. And excitingly, that meeting led to some potential collaborations between member organizations, and we got some ideas to work on initiatives such as creating a more streamlined coalition database to make that collaboration and referrals amongst members easier. We're hoping to seek out funding sources to create those connections and networks. And we were thinking about hosting a guest speaker to talk about engaging rural communities, such as the SCAN Foundation. We also created a policy brief on research projects done alongside coalition organizations such as the Curry Senior Center and Peninsula Family Service, and I'll be talking about that more in a little bit near the end of this meeting. We also attended the California Department of Aging's 2024 Day of Action for the Master Plan of Aging, where we connected with statewide leaders and heard about different working groups' recommendations to improve healthy aging for those all across the state. And that was a really energizing day. It was really great to be there. And you can see a picture of me and Dr. Carla Prestinoto there. And lastly, if you're new, welcome. We have a bunch of lines of communication that I can follow up with you through email, such as our coalition office hours, our biweekly community roundups, and our quarterly newsletters. So I'll be in touch to share that information with you. A few upcoming initiatives. We're working on setting up some coalition field trips for next year. I can't believe it's already almost 2025 to have you all, if you're able to, see each other's working sites, learn about programming in person or virtually. I'm also working on a report of the impact of social connection coalitions. There are a lot across the country. And then lastly, we're working on community-based resources, such as customizable social connection resource guides for different counties and communities. And lastly, I'm really excited about this one, and I'm hoping to establish a working group on it soon, an interactive network of our coalition organizations and other local and national social connection organizations. So that resource we're hoping to kind of model off of the three components of social connection as said by the Surgeon General's report. So obviously all your organizations work in some way to increase the structure, function, and quality of relationships in your clients. So we're still in the beginning stages of what this resource is going to look like, but I'm excited to work on it alongside you all. And lastly, I wanted to highlight this event put on by the Telegraph Hill Neighborhood Center in July. They had an aging and older adult resource fair, and they had 285 older adults attend, along with 50 representatives from 24 different organizations. They served over 318 lunches and provided over 250 scoops of Ben & Jerry's ice cream, which I love and I heard was a huge hit. And importantly, they conducted 50 health screenings and also enjoyed a dance movement demonstration. So I love to highlight what everyone is doing in the community, and thank you, Coletti, for sending this in. And so before we welcome our guest speaker today, I wanted to discuss how Amanda Spott's presentation and our policy discussion afterwards ties into our coalition goals, specifically increasing awareness of social isolation and loneliness and advocating for funding and policies to support social connection initiatives. So Amanda will be talking more about how CESIL brings together organizations across the nation to develop and advocate for federal policy solutions to address social isolation and loneliness. And then she'll also be sharing how local coalitions such as ours can contribute to national policy efforts to increase social connection. So with that, I want to introduce Amanda. Amanda Spott is a senior policy analyst at Healthsperien, where she works on legal and policy issues related to social isolation and loneliness, healthcare coverage for older Americans and people with disabilities, and long-term care. And prior to joining Healthsperien, she worked at the National Alliance of State and Territorial AIDS Directors as a legal research manager, where she specialized in state policy issues, including HIV criminalization, data sharing, and drug pricing programs. And previously, Amanda worked as a senior researcher in the George Washington University School of Public Health, interned at several policy consulting and research firms, and volunteered at the National Eating Disorders Association. And Amanda received her dual JD and MPH with a concentration in health policy from GW. And so she's going to give a presentation. We'll have some time for Q&A after, which I'm excited for you all to take advantage of. And before I turn it over to her, I see that Carla, you have your hand raised. So let me stop sharing my screen for a second. And
you can leave it on there. I just wanted to say good morning to everyone again. And just to add to this, I'm just really excited about the work that we're doing. And now that there's more of us, one of the reasons we wanted to get Amanda on here is to think about what we can do as Californians and as people representing different organizations across the state, what we can start to do collectively at a policy level, if that's of interest to this group. So have this be kind of the first time for us to really start thinking about our collective voices, which is also important. I will not say the E word election coming up, but it's kind of putting into my mind in terms of what we can all do to really get our voices heard. So with that, so glad to see you all here. And thanks, Amanda, for joining us.
Carla.
Hello, I'm Amanda. Thanks for the lovely introduction. I think I can share my screen for these slides. Is that full screen for everybody?
Yes, thank you.
Awesome. Great. So yes, as Nandini said, I'm Amanda. I'm a senior policy analyst at CESIL and Healthsperien. And I'm just here to give you some 2024 policy and advocacy updates and talk a little bit about coalitions and what we can do as a national coalition and what you all can do as a state or local coalition to really get some policy change done. So first, a little bit just about CESIL, the Coalition to End Social Isolation and Loneliness. We were established in 2018, and the coalition seeks to address the adverse consequences of social isolation and loneliness, and then advance approaches that improve connectedness for all Americans. And we hope to do that by engaging diverse stakeholders, increasing public awareness, promoting innovative research, and advocating for policy change. And so, as I mentioned, diverse stakeholders, this is just a snapshot of some of our members. So we really try to engage a wide variety of stakeholders in our work. So, we have everywhere from Pinterest and Hinge, some social media type companies, all the way to, the American Cancer Society. And we really just try to include people at all levels in our work. So that's something that we really value. And hopefully, you guys can start diversifying your coalition membership as well. We think that's just really important for this work. So this is just a PSA, basically. We are rebranding starting next year. So we will, going forward, no longer be known as CESIL. We are merging with our sister organization. So starting in January, we're going to be called the Foundation for Social Connection Action Network. And it's really not changing our mission or what we do. We're just hoping to streamline some of our efforts because right now we're two organizations, and so we're merging essentially into one. So if you start seeing Foundation for Social Connection Action Network around, that is still us. Just wanted to let you all know that this is coming. So something that we really like to stress and that underlies all of our policy work is really evidence-based research. And so I just want to highlight like a few things. I'm sure you all have seen some of this before, so I won't spend too much time here, but one really important piece of evidence that came out was the CDC 2022 Behavioral Risk Factor Surveillance System report. And this was measuring adverse social determinants of health and health-related social needs among US adults. And what this data basically showed was that nearly a quarter of Americans reported that they lacked social isolation and emotional support, or lack of social and emotional support, and that 31% reported feeling socially isolated or lonely during the study period. So this really just provided us with some good data that underlies a lot of what we do. And so we always want to like come back to this data that really just shows that somewhere between a quarter and a third of Americans are feeling the negative effects of social isolation. So it really is a big problem. And as you all know, coming out of the COVID pandemic, we saw even worse outcomes. So we just always want to be drawing from the research base. And this was a really important and helpful study that came out. So to sort of contextualize the social isolation issue. And research also shows that while all of us are at risk for social isolation and loneliness, some communities are more vulnerable than others. So we always want to keep in mind these vulnerable populations while we are advocating for certain policies. So we just want to call out, people experiencing lower socioeconomic status, unmarried and unpartnered individuals, people with chronic conditions and disabilities, LGBTQ plus individuals, caregivers, new parents, minority race and ethnicity, veterans, members of immigrant communities, people who live in rural communities, and then for children and adolescents, those who have a weaker family structure or lack of family support, and then children and adolescents who do not experience social connectedness and belonging at school. So these are just some groups that we always want to keep in mind when we're advocating for policies and making sure that policies are touching on these groups of people and making sure they're included in our advocacy efforts. So here are CESIL's 2023 to 2024 policy priorities. So of course, it's the end of 2024, so we're going to be changing these a little bit for our next year. But I anticipate that some of these will remain the same. So just wanted to highlight what we're focusing on in our policy efforts. So increasing public awareness around social isolation and loneliness, enhancing social services and supports that address social isolation and loneliness and promote social connection, advancing health services and supports to address social isolation and loneliness, leveraging innovative solutions that foster connection and social integration, and then advancing research. Again, this evidence base really informs all of our work and everything that we do. So just making sure that's included in our policy efforts. So you guys have obviously seen this, but we just wanted to highlight a few wins that we've had over the last few years. Social isolation seems to be taking more of a, being at the forefront of what the public is talking about, and that's really great and a huge win. So we just wanted to highlight, as you know, the Surgeon General last year said that officially declared the epidemic of loneliness. And so this was a huge win and a great resource for everyone to use and be referencing. I won't spend too much time here because I know you all have seen this a bunch. But something else that is really important is the WHO created a commission on social connection. And we are expecting that there will be some research or a report coming out pretty soon that we're keeping our eye on. This commission was for 2024 to 2026. So, we're nearing the end of the first year of the commission, but hopefully we get some really good data out of this. And, this will also hopefully bring social isolation and connection onto a global platform, which is great and just another huge win. And we hope to see more groups and commissions like this going forward. So I wanted to highlight some pieces of legislation. Obviously, Congress is in recess right now, so we're not seeing a ton of movement or don't expect to by the end of the year, but you never know. So we just wanted to highlight some national pieces of legislation that we have been working on. And we do have a pretty close relationship with some of the senators and representatives who are pushing for this legislation. So we've really tried to be involved at every step of the way as these bills are being passed and edited, and as they go through the legislative process. So the first piece is the National Strategy for Social Connection Act. This would hopefully create an Office of Social Connection Policy that would then be tasked with setting a national strategy on social connection. So that really touches on a lot of our policy goals, and would be great if we could get something like this passed. It would also support the CDC's continued research on social connection, and again, just making sure that the research is still being done to really capture the breadth of this issue. So the next piece of legislation is improving measurements for loneliness and isolation act. This is it's two pieces. There's one in the House and one in the Senate that are companion bills. This one is essentially focused on standardizing definitions and measurements. So it's a little bit less. Oh, I'm so sorry. I lost my screen here. Okay, everyone can still see. Sorry, some technical difficulties on my end. Anyway, this one is really focused on developing standardized definitions and measures for loneliness and isolation, so that across the government, all federal agencies are using the same language to talk about this issue, which is hopefully just a first step in getting something, getting research going. So another important piece of legislation is the Addressing Social Isolation and Loneliness in Older Adults Act, and that's a mouthful, so the SILO Act also works. This bill would provide grants to eligible AAAs or and other community-based organizations to conduct outreach to individuals at risk for social isolation and loneliness. So really focused on at risk, those vulnerable populations, which is really important, and a really important part of our work and something that we want to highlight. And then, of course, the Older Americans Act reauthorization. As we all know, it was not officially reauthorized by the September deadline. So we really are hoping to get this done, if possible, by the end of the year. We'll see. But if not, then early next year. And so we're really encouraging our members to not only focus on reauthorizing the act as it was, but also modernizing the aging network to meet our current and future needs. So we are hoping that we can get some increased funding levels for all Older Americans Act programs, creating even more investment in programs that reduce social isolation and loneliness, directing even more resources for training, technical assistance, and evaluation, and then providing more guidance and technical assistance to help states. So we are hoping not only to get it reauthorized as it was, but also to add some important pieces. So this is somewhere where, at the state level, you all can also help advocate for this. And, if you have any state or local priorities that you see, things like submitting comment letters, I'll talk about this a little bit more later, but that can be really helpful and important. The more voices, the better, really, for this, and hopefully getting this done by the end of the year. But yeah, we'll see where the election takes us. So this is a resource that I just wanted to highlight. We created an action guide for building. Oh, sorry, was someone jumping in with a question? No, okay. So the action guide is linked here, but I just wanted to give you a little overview. And this is basically like a step-by-step process for ways that you all on a local level can create programs that enhance social connection. So, you can go through this guide later. It's really quite comprehensive and detailed. But I just wanted to highlight that this exists and hopefully is really helpful for people as a resource to start, if you're trying to create a community program or something like that, this guide can be really helpful. So I'll just run through the steps really quick. But step one is really just reflecting on the current state of your community. Step two is reviewing the social connection background. So that's really like getting your research base. The third step is creating an assessment, a community social connection assessment. So seeing what's already out there in your community, which resources and groups and community-based organizations can you bring together to support your effort. Step four, planning your social connection initiative. So that's the planning phase. And then step five is tracking, always making sure you're tracking and measuring as you go along. And then finally, evaluating and sharing out. So if you are getting good data that might be able to help other communities create programs, making sure we're sharing our resources as we go. So yeah, feel free to dig through this later on your own as well. I'll make sure you all have access to these slides, and it's linked right here. So I also wanted to highlight some state and local actions that we've seen over the last year or two. New York at the end of 2023 appointed Dr. Ruth as the state's first honorary ambassador to loneliness. And we are awaiting a potential replacement. Obviously, Dr. Ruth passed away this summer, but the work that was started is hopefully something that will continue, and something that maybe other states can follow. And just getting loneliness on, to be recognized in the media, in the public is really important. And so things like this, appointing an ambassador to loneliness is just something, a little win that we can celebrate, and hopefully other states follow suit in the future. Obviously, you all are from California, so you probably know about San Mateo County, but they were the first county to declare loneliness a public health crisis. So just highlighting that on the local level, it's not just the Surgeon General who can declare an epidemic, but we can really be pushing our local and state stakeholders to get involved as well. And yeah, this was just a great declaration to highlight. So something else that's really important is having a champion. For us, again, we're a national organization. So for us, someone like Senator Chris Murphy from Connecticut, he's been a really impactful champion for us on social isolation and loneliness. And he hosted a summit earlier this year, I think it was in March, that brought together state and local officials, civic organizations, community-based groups, and lots of other stakeholders to talk about how they can really work together to build those social connections. And they just had, they had some keynote speeches, and they had some panelists come and talk, and things like this just really bring people together. This is obviously on the state level, but Chris Murphy has been a really great partner for us. And so we hope to have more champions like him in Congress going forward. But on a state level, it's not just your senator, but it's also your local representatives who can, be a champion for our cause, and who you all can reach out to sort of help get things done on a smaller scale. And then I also want to highlight just a couple of national community-based programs. These are both AARP and CaringBridge are two of our members. I saw someone on the call seems to be from a similar program. I saw Friendly Voices, but AARP has a similar program called Friendly Voice, which is a call line that people can call into and speak to a volunteer on the phone. And this has just been a great program that allows people, especially people who can't leave their house, or if they're in a rural community and just don't have access to in-person community programs, to just have access to somebody on the phone. So just an idea of something that could be a program that could be implemented on a local scale. And AARP is also a new coalition member, so we're very excited to introduce them in 2025. And then CaringBridge is a free nonprofit health platform that connects. It's for caregivers, so people who are supporting their loved ones and supporting their healthcare in a caregiver capacity. That's again one of the groups that has been shown to be more vulnerable to feeling socially isolated. So CaringBridge focuses on that group and creates a platform to connect them to each other. And people who use CaringBridge experience 3 times greater feelings of connection to family and friends than the national average. So they've seen some really great results from their program. So yeah, just wanted to highlight some smaller national programs that can be adapted on a local level and community-based level. So here is what you all can do as a coalition to advocate and influence policy. So we, CESIL, created a toolkit for our members that was really, for us, it was focused on the Older Americans Act and getting it authorized, but these steps can really be applied to any law or policy. So we provided 5 steps that you can follow when you're conducting outreach to lawmakers. And then we also included a little social media toolkit that our members can use when they're posting on LinkedIn. We had some draft language in there that can be just copied and pasted, for LinkedIn or Twitter posts. And we also had some sample graphics for our members to share out. So this is something that, as a coalition, this was a really helpful toolkit that our members received. So on a coalition level, you all could, of course, create something like this, but also using us as a resource. We, did this for our members, but we're hoping in the future to something that we're talking about for the future is engaging more on the state level. So toolkits like this might be coming down the pipeline. I am really curious what would be helpful on your end from us as the national coalition. But just wanted to provide a little bit of an example of the types of resources that we provide to our members in case this is helpful for you all on a local level as well. So as that is all I have as far as content goes. So if anyone has questions or comments, I would love to answer them. And then, of course, just getting your feedback on what would be helpful from us to help you all moving forward would be great.
Awesome. Thank you so much, Amanda. We really, really appreciate it. And I'm excited to have this time for Q&A for all of us to ask you some questions and also, like Amanda was asking, share our feedback on what would be helpful. So if you wanted to, I think it's on your end if you wanted to stop sharing your screen.
Oh, yes.
Perfect. Thank you. And then we can open up the floor.
I'm actually curious from the group, and either speak up or put in the chat if you have questions for Amanda, but also, again, with this idea that we're all local here, if there are thoughts that you guys want to start brainstorming about things that we should be approaching for either at the regional, Northern California level or at the state level, taking examples from what Amanda's talked about. And also one of the things, so I actually sit on the board for the coalition. And so we're also starting to think about how the national organization can intersect with the local organizations or the local coalitions. So I'm looking for ideas too.
On it for a little while. I was eating blueberries and didn't want you to see me. I run the Napa Solano Area Agency on Aging, and for 4 years, 4 years ago, I came to the realization that understanding that for AAAs to purchase tablet computers and iPads, those types of things, so that seniors could stay connected. Especially, it became very important during COVID. It was nearly impossible for us to do that with our funding, to allow providers to do that because of this stupid rule in the SAMs, the State Administrative Manual, that requires every electronic device to be looked at annually for the life of the product until it dies or is gone. And if it's gone, then you have to fill out this other form. Anyway, because of the administrative burden, we can't allow our providers to purchase these things, to reduce isolation, even though it's in the master plan for aging. So I've been working to get that changed legislatively. And just this week, we heard from Aguiar Curry's office that she will take this up as a legislative change. And doing so will allow thousands of older adults who are homebound and lacking connection to connect with people. So when I hear more about the next steps from Aguiar Curry's office, Assemblyperson Aguiar Curry, I would love statewide support. And I even have the support of the California Department of Aging, although they can't vocally say anything. They don't want to track this stuff either. I've had multiple conversations with them. So, I think things like that we could all help with.
I think that's highlights something really important too, that hopefully this was clear in my presentation, but I just, highlighting things like that we as a national coalition, we don't necessarily know because we're not working on the ground every day. So it's really helpful to know those things when we're advocating on a national level for something like Older Americans Act reauthorization, because something like that, you need the increased funding. And in addition to that, you need the funding to be allowed to be used for the thing that you need it to be used for. So yeah, that's an awesome call out. And again, a reason why we're hoping to work more closely with the states going forward, because there are things like that, should be advocated for on a national level as well. And it's really helpful to know. So thank you for sharing.
Amanda, this is Rebecca Garrowell. I love to learn a little more about what your slide about the congressional measurement motion towards improving measurement for social isolation. I mean, obviously, government is a little busy right now, so nothing is happening. But I think it's such an important issue that we're all of these organizations, we're on the same page in terms of how do we measure our impact, and that's something I've been struggling with. I mean, we know that we're making a big difference or making an impact, but actually quantifying that so that we can and sharing that together. So I'd love to find out both from you in terms of what's happening in those bills. I mean, doing it at a congressional level seems crazy to me, but anyway. But learning from this group also on what's being done would be really helpful for me.
Yeah, so let me just also clarify, that is aligning across the federal government. So it is, just among government agencies, which of course is a big lift as it is, but that's not necessarily, saying that the states need to do that as well. It's just saying across the government, this is how we're going to measure it, hopefully, if something like that gets passed. But I think that would then set an example for the language that states can use going forward. So just wanted to point that out. But yeah, if anyone else wants to jump in and answer that question.
I can jump in on that. So the question of measurement is probably it's come up for the last 15 years since I've been working on this. And the challenge is that what we believe scientifically should happen with measurement is not often what community-based organizations want to do or is feasible. So we're trying to find that middle ground. A couple of things on the Foundation for Social Connection side, which is the scientific advisory, which convenes all the kind of academic experts in the space. That is something that we're also working on convening in terms of getting some measurement. But there are different tools. And Rebecca, we can certainly talk separately with you. Donnie and I can meet with you to talk about that. But there are different groups. Matthew Smith has worked on a new tool and is actually working on piloting on that with that. And that's actually in the, I think, older adult work group within the coalition, that there's many organizations involved in that. So this is a local, very real problem or thing we're struggling with. It is a national problem, and it's actually something that our global community, GILC, is also working on, because there are some differences in terms of how we're measuring. And interestingly, our teams are also speaking at the Gerontological Society of America in like a couple weeks on this issue as well. So more to come. And we've had many sessions before in this coalition or discussions around this, because there's some nuances here. So it's an important question. And I think if that's something that this group wants to spend more time on, get back to this issue, because I think there's like, what do we need for scientific validity? What do we need for reporting validity, which are not always the same things? What is feasible? And lots of things. And I know I see Catherine from the Meta Fund, and I know, Catherine, your team has supported many organizations in terms of evaluation, and so lots of things we could probably talk about here. But
Okay, thank you.
Yeah.
I just put in the, so sorry.
No, I was just gonna, you go first. Yours was.
I just wanted to say, I put the Foundation for Social Connection. They have a social connection measurement tool inventory done, so I put that in the chat. And then before, I have a question too, but I wanted to say that Stephanie had a question in the chat as well, about the slide about vulnerable populations didn't include older adults. Can you share why?
Yes, that is exactly what I was just about to address. That, quite frankly, is an oversight on my part. I think that when I think about it, older adults are always who we're talking about. And so I think that was just underlying. But I should have clarified that was in addition to older adults. Yeah, sometimes in the work you get, when you think about older adults all day, that seems like it's implied, but it really isn't. So yes, I definitely should add that to the slides going forward. But thank you for calling that out. Older adults are certainly a big focus of our work. So
yeah, it's funny that you say that, Amanda, because we can talk about this a little later, but we were working on a policy brief, and we're talking about how peer programs can support the social connection of older adults. And I feel like a lot of the feedback we got on our first go at it was that we were so zoomed in, and a lot of people don't even know, like, what is social connection? Why does this impact older adults? We had to take a really big step back to just remember, right? Like, I'm like, yeah, peer program, social connection, social isolation, loneliness, but how do we take a step back to make it more accessible? And that actually, I had a question about that. It's a little bit larger picture, but Carla and I know a few others, we were at the California Department of Aging's 2024 Master Plan of Action, Day of Action for the Master Plan of Aging. And something we noticed was that in a lot of the presentations and recommendations, social connection or social isolation and loneliness was such an underlying issue throughout what everyone was talking about, but it wasn't named and it wasn't addressed really as this is an issue in our world of aging. So I know you were mentioning that during your presentation of, creating this language to talk about it, but also as a coalition and, in our work, how can we better, make it known that this is an underlying issue throughout, all of the different things that we're talking about, whether it's, people not accessing resources or why people aren't getting the healthcare that they need. Do you have any advice for that?
Yeah, I mean, it's hard, of course. I think there's always just checking yourself and taking that step back. And when you reread if you're publishing a policy brief or anything, of course, you can always send that to us for a second look, because, we are here for you as a resource. But yeah, I think it's a hard question to answer. I don't know if I have any direct advice besides just being aware of it and, making sure that you're always thinking of it from an outside perspective and coming at it from the perspective of the reader. And, who is this for? If it's for the public, do people really know? Because, we do this all day. So, of course we know. But then, I come here and I forget to put older Americans on the slide. So, because, to me, that's implied, but is that really implied to your audience? So I think it's things like that, and getting multiple eyes on a piece of work before it's put out can really be helpful. And, if that's something that would be helpful, I can also bring this to my team as a potential resource we can put out too. Doing things like this is great for us too, because then we really can hear what the issues are, what you guys are experiencing, and hopefully provide resources to help. So I will for sure bring that to my team as an idea.
I also think this is where this group is so helpful, because it's actually not uncommon when we discuss vulnerable populations to not include older adults. And we saw that in the pandemic, that often we were talking about who was disproportionately affected, focusing on racial and ethnic minorities and not older adults who were actually who was most affected. And so it's this is why we have these conversations, so we all have uniform language and can keep bringing this forward. And with that, actually, I see this question in the chat about, is there research in older adults who are for non-English speakers? So interestingly, Hassian, I'm not sure if that's how you say your name, Hassian, great. From the National Academy of Sciences report from 2020, one of the big conclusions is that we actually really do not have enough research on non-dominant, pick your term, populations. There is some, and it's mixed in terms of, some research saying actually some communities that are non-dominant in the US may have different experiences because of family structures. Certainly, we know that being non-English speaking is a risk factor in the US. That may vary, again, depending on what community you live in. But again, this is why, if there's an opportunity for our group, our coalition, to have a policy brief on why this is needed to really push some of this forward, this is where our collective voices will be helpful. So thank you for bringing that up.
Absolutely. Thank you. And I think we probably have time for, one or two more questions if there are still questions from the group. And if not, that's okay. And, I really would like to thank Amanda for her time. And if it's okay with you, Amanda, if there are questions or, we have some advice that we need from you, if we could have you as a resource, I can also send forward any questions that we might have later, if there aren't any right now.
Definitely. Yeah. Feel free to reach out. I'll make sure that you all have access to my slides too.
Perfect.
And my contact information is in there. So feel free to email me if you think of additional questions. And yeah, if you have anything that we can help you with going forward, please let us know.
Yeah, I guess actually I just thought of one more question. I know you touched on, how we can, as a coalition, write to our local policymakers. And it was really inspiring and great to learn more about what is being done on the national level to advance this policy. Are there any other ways that, we can support the work that you're doing to push things forward on a national level?
Yeah, I think one of the main things is the more people that, when there's a comment letter opportunity, or for example, keeping your eye out for, we recently submitted a comment letter. Actually, I think it's going out today, but it's HHS released their Healthy People 2030, some additional objectives that they were including in Healthy People 2030. And we read through them and realized hey, none of these actually address social isolation directly. So, we wrote a comment letter and who knows how many of these are actually being read and, if that's going to do anything. But I think being aware of those opportunities and always keeping your eye out as much as you can. Of course, there's limited capacity in some groups and, yeah. Staffing constraints are for sure a thing. But that's, I think, something that we can also, publicize. And we can do a better job probably of that and communicating that, hey, this opportunity exists. And if you all want to sign on or write your own letter, just having the more people, the better, really. The more voices that can be heard and pulling in those state groups, even if you're commenting on a national piece of legislation, that can really allow you to pull in the things that are affecting your region and that you're seeing in your local organizations for the people who are working at the national level to think about. So yeah, I think any of those common opportunities, of course, reaching out to representatives, but yeah, keeping your eye out for things like that can be really helpful.
Yeah, perfect. Thank you. And what you were saying about, publicizing those opportunities, I think to answer one of your questions from before, that would be really great, I think, for us to be aware of those opportunities. So yeah. Does anyone else have any questions before we move on?
All right. Well, something in the group about internet deserts. This is definitely an area of focus, the internet deserts. I think as with everything, there could be more research being done. But this is definitely something that I've seen in the literature already, especially post-COVID. But that is definitely something we should keep our eye out for and be thinking about. So that's a good call out. Thank you, Melissa.
Awesome. Well, thank you so much, Amanda, again for joining us. We really appreciate it and are really grateful to learn from you and learn about all the initiatives that that you have going on. And you know what, you're welcome to stay on for the rest of the call or hop off, whatever you see fit. But thank you again. And before we move on, you know, I think Amanda set a really great, gave us a really great foundation for a longer discussion about what we're hoping to do as a coalition. So I'm gonna put us in some breakout rooms with some questions in a little bit to, you know, make sure that everyone can contribute in a little bit of a smaller environment. Before we do that, though, I just want to highlight a few more initiatives that other coalitions have taken on and implemented in the past, specifically around raising awareness as well as, you know, working with local policymakers. So this is an example from the Wisconsin Coalition for Social Connection. They advocated for a Social Connection Awareness Week Summit, and they actually worked with the governor of Wisconsin to make that happen. So that's taking place this in a few days. So that's a really, you know, exciting initiative that coalition was able to pass. And to highlight the California Volunteers through the Office of the Governor, they recently launched this awareness campaign of Meet Six Neighbors that encourages people to just connect with the people that they live near in their neighborhood. You know, that's something that I think in this work we've realized that we've kind of been losing as a society. And, you know, if you've read like Bowling Alone by Robert Putnam, that has really highlighted that issue. So they are starting with just this very, you know, human-centered campaign. And so they have a pledge online where they're sending to people, but they're also spreading the word through just print materials and mailboxes and things like that. And I lastly wanted to highlight there are these network maps. This is actually through the Foundation for Social Connection that's used to connect groups doing social connection and engagement work. This one we're actually on. It's a Social Connection Communities of Practice network map. And as I mentioned at the beginning, before Amanda was speaking, we're hoping to make a similar type of map that groups local organizations by the work we do, making collaboration and referrals easier and making that more streamlined network platform. And lastly, I wanted to highlight, we were going to be joined really briefly by Maureen Feldman, who leads the LA Coalition for Social Connection, but she got called in for jury duty. So we're hoping to have her in next time. But she was going to talk about the work she's been doing with LA County through her coalition. They've been around for a while, I think almost 10 years at this point. And she was able to work with the team that was doing the Purposeful Aging Los Angeles initiative. They actually didn't really have any language or initiatives in there about improving social connection among older adults. So she was able to work with that team to really hone that language and make sure social connection was a part of the Purposeful Aging initiative. So hopefully soon we can have her on to talk a little bit more about that. So before I stop sharing my screen, those were just a few examples of how coalitions have also been raising awareness as well. I'm going to put us into some breakout rooms. These are just some questions to consider, but you know, feel free to go where the conversation takes you. Really focused on what do you want to see done as a coalition? What are you excited to work on? What initiatives can we start planning? So I'm going to put us into a breakout room for approximately 12-ish minutes. I'm also going to put a Google Doc in the chat where it has these questions, and you can feel free to type notes on the Google Doc from your group if you'd like. I'm going to ask that when we come back, each group has a person to share out approximately 1 minute on what they were talking about and what they're excited to work on. So I'm going to stop sharing my screen. And put us in some breakout rooms. And here is the Google Doc, and then the breakout rooms should open now, hopefully. Cool. So I will see you. I'll stay in the main room if anyone has any questions, but I'll see you all soon. And Adam, no worries. I got your message. Thank you for letting me know. Oh, I think you're muted.
Thanks, Nadine. Good to see you.
Yeah, good to see you. Thank you so much for joining.
It was
Talk
great. No,
soon.
good stuff. Look forward to seeing you soon.
Yeah, thank you.
Bye.
Welcome back.
It spit me back and looks like just the two of us are here.
Oh,
That-
I think maybe, yeah, everyone will slowly be coming back.
I don't know. It's very odd because
Yeah, usually it gives you like 60 seconds.
there we go.
There
Okay,
we
it
go.
said 60 a minute. It's just our
Yeah, interesting that usually I feel like it gives 60 seconds across the board, but hopefully.
I was talking to somebody at one point, Daniel, because you're in San Francisco. There was a young guy who was he was doing sort of walking groups. And he was as he was doing these walking groups with older adults, and he was talking about then trying to get in funding from insurance. So,
Oh, interesting.
yeah, I can I can give you his name if I can look for it.
Well, I'm no longer in San Francisco, so
Okay.
it's
Okay. But it was an
but
interesting idea.
I'm going to assume our group was number one since there are no notes written there because I didn't write them there. So can I copy and paste them there? There we go.
All right, I think almost everyone is back. So thank you everyone for taking the time to engage in discussion. I definitely would love to hear a little bit about what everyone was talking about. So if anyone from any of the groups wanted to get us started and maybe give, a one-ish minute overview on some of the things you talked about.
I'm happy to start if we were in fact group one. I'm Amber Carroll with Front Porch, and I was joined by Friendly Voices and Curry/UCSF and Providence Day Health and Little Brothers for the Friends of the Elderly. So we really just kind of were addressing that first question of issues and policies are we interested in addressing here. So I can kind of just run through that. So really, a lot of it fell onto funding, some of it more specifically around adult day programs, and certainly all of our programs. We talked about that really huge funding gap for the forgotten middle, but I think across the board, since all of our programs serve a variety of different people, generally funding. So also longer term funding solutions. So we're not on this chronic hamster wheel of applying for a little grant and then applying for another little grant in the end. General caregiver support was another thing, and how we might work as advocates for the caregiving world to change some of those rules and regulations so that caregivers can really access a lot of the cool stuff that all of us are doing on this call to support the work that they're doing. Accessibility, and also being respectful of the digital divide. Lots of us have a lot of people in our programs who don't have access and or interest in the internet, and we want to provide social connection, meaningful social connection for folks, regardless of where they are in that. I added this, I'm not sure we really talked about it, but that evaluation piece that I think we're all aligned to sort of be on the same page with what and how we're evaluating what we're doing. Local and national advocacy and policy work. We also talked about sort of the social determinants in health and how can we engage insurance companies to be partners in this work, and help support the work we're doing. So that's as far as we got. Did I miss anything, or does anyone else in group one have anything to add?
I think you got it all, Amber. Thanks.
Yeah, thank you so much, Amber. Definitely mentioning lots of different topics that I know Carl and I have been talking a lot about that are very, very important to the work we're doing. And I do want to also follow up with Amanda on how she was saying they're trying to standardize evaluation metrics, at least on the federal level. So if I get more information on that, I definitely want to pass that along to you all as well. What about any of the other two groups, if they want to share what they were talking about?
I'll go. I wrote down our stuff in group 3, but I think we were group 1. So whatever.
Yeah, it's all good.
Whatever. So we were not as organized as Amber's group in terms of, or in terms of the other groups, but I'll talk broadly about the themes that came up. We actually talked a lot about kind of digital equity, but digital equity in the broad sense, which is not just about providing tablets or broadband for the sense of becoming tech literate, but really to providing tablets and technology as a means of social connection. So I think that was a broader topic that was really important, that kind of trickled down from the policy to who we advocate with to actually what happens as service providers. So I think that was a really big theme. The other things that came up, which I really appreciated from the direct service providers, is that sometimes the direct service providers are so focused, importantly, on the direct service that they're not in a place potentially to be working on the policy level. At the same time, the work of the service providers is actually what can influence what we then talk about, maybe at the broader coalition at the policy level. So I really loved the idea that, bringing up things from the direct services, like we have this huge initiative, CalAIM in California, like why should we start talking about, is CalAIM a vehicle to actually really think about bringing social connection and supporting some of our organizations around this work via CalAIM? And then again, getting back to this, digital equity and device thing, like just some really interesting things that could be helpful to bring to CDA or potentially others around the funding that goes into providing tablets. But again, there's like the bureaucracy around that makes it kind of a disincentive to even want to have these tablets because it's so onerous. I think in the grant world, sometimes in academics, we think about it as bean counting, is that there's more bean counting and less actual, like what matters to people, which we should think about. Maybe this came to me is that in age-friendly health systems, one of the 4Ms is what matters to people. And maybe we start thinking about evaluation and the receipt of these things is what actually matters to the organization people rather than the funder, but that's a bigger thing. I think in the interest of time, I'll leave my notes there, but I think that was a big focus of what we were talking about. And then lastly, in terms of other people to partner with, is that I think, especially around the world of digital equity and tech, is how do we better partner with foundations and the private sector to sustain these initiatives for on the ground service providers?
Yeah, thank you, Carla. And how about someone from our last group?
I can read our notes. Let me find it.
Thank you, Jessica.
Where was it? If there's so many tabs. Oh, here it is. Okay, we try to tackle each question, and we're group 2. Okay. So for question 1, some of the things we discussed, everyone chimed in, was about the importance for them to connect older adults with each other, increase activity because it's critical for their health. Also, the need for older LGBTQ and older adults to receive appropriate services, culturally appropriate services, as well as non-English speaking groups needs, and finding what services already exist to help people socially connect. And we heard about language being one of the biggest barriers, and also finding programs to prevent isolation that are culturally accepted by the community that they're serving. And someone gave an example of a program that they try to run that wasn't well received by their community, and it could have been not appropriate culturally for them. So the groups how can the coalition work to influence these issues, and what organizations and government entities are important to engage with? So some of the names we heard are the Department of Aging and Adult Services, CASE, Coalition Serving the Elderly. I was not familiar with them. So there's one. Department of Public Health, the Mayor's Office, even UCSF is a larger entity, agencies on aging connected to the local, state, and federal levels. And also we added in health plans because social care, social health is so important to somebody's overall health. So why not talk to those stakeholders that care about the cost of healthcare and what that means on their end, and how can they support the work we do. And finally, for the last question, what are the deliverables or projects that we would be interested in working on? I think we talked about funding advocacy is an important thing for us as organizations. And there was someone shared this last question, could UCSF write a paper about isolation or the impact that social isolation and loneliness have on health to help support the efforts? That's it.
Yeah, thank you so much, Jessica. I'm really quickly going to drop for whoever asked that question. We have a tab on our page with a lot of the research that Carla and Dr. Coatwall have done through over the years. So, we have many ideas and research in the works as well, but this is hopefully can be a good starting base that we will continue to draw from. And thank you, Jessica, for sharing. And Carla, I see that you wonder if we should think meeting with our local health plans. Yeah, I think that was a great idea.
I think it's just an idea to start mulling over in terms of sometimes we think about the very large health plans nationally, but I think maybe starting locally or regional makes sense. And just, Jessica, something to note about the question about healthcare outcomes, just to add to that, there is, the one large study that AARP did with Stanford that showed the overall, 6.7 billion in overall Medicare spending.
Mm-hmm.
Interestingly, our group and many want to do direct outcomes research. It's actually incredibly expensive and complicated research. So like all of you, we struggle with funding for research as well, but that is certainly top of mind for many of our national researchers, including us, to do if X adult participates in X project, what are the healthcare outcomes? But it's amazing how methodologically challenging that is, but it is still on our would love to do. So I appreciate all these ideas to keep us going and applying for grants to get this going. So
yeah, absolutely. And I just wanted to say, I'm really excited to hear all of the feedback and thoughts you have from your discussion. And I know Carla was mentioning, it's hard for people who are engaging in direct service to really engage as much in policy. And I'm hoping that that's where I can really step in. As the director of the coalition, it's really helpful for me to hear about what you all want to work on so I can leave this conversation, really think through everything I heard and what you all want to work on, start working on initiatives, maybe establish working groups, a policy working group if people are interested in long-term supporting certain initiatives. But that's really how I hope that my role in the coalition can benefit you all in the work we're doing, is taking your ideas and having someone who has the time and capacity to really make them happen. So I really want to thank you for all of the discussion you had today, and I'm really excited to get to work on some of the things we were talking about. So I know that we have about 10 minutes left. I think we can hopefully let you go a few minutes early, but I wanted to end by sharing some of the, policy work that we recently just finished really quickly, and, maybe give you some ideas on if you have any of your own research or findings that you'd like to share on a wider audience. This is perhaps a way that you can do that, and we can support you through the coalition and our UCSF team. So we recently wrapped up a study with some of our coalition members, including Prairie Senior Center, Peninsula Family Service, Rams, Shanti, and Front Porch, on how peer programs were able to adapt during COVID-19 to better serve their older adult clients and increase their social connection. And so our papers on this topic are currently being written. But, with Carla and Ashwin, we were having conversations about how we wanted to share these findings with the greater community, not just publish in academic research and then have it sit there. And maybe some people will see it, but how can really engage community members, policymakers on this? So that prompted us to create this policy brief packet, which we just wrapped up. And so it was a new experience for the lab. As I was saying, we hadn't really worked yet to translate our research into policy recommendations. This, I'll send out the whole packet after this meeting, but this is some of our executive summary page, with one of our main findings being that the adaptations made by peer programs during the pandemic did help older adult clients address their social isolation and loneliness throughout COVID. that led to 3 areas of focus to really break it down for the policy brief, which is 1, increasing peer capacity, 2, including peers in public health emergency responses, and 3, increasing the accessibility and sustainability of the Medi-Cal peer certification process. And so I know the font is tiny. Again, this is just an example of how we laid out our policy brief. If we're looking at how we discussed peers' role in public health readiness, we had 1 page really giving an overview of our finding, quotes from people involved in our study, and kind of main features for how that could look. But the main exciting part was writing policy recommendations, and we learned a lot through this process. So again, if you're interested in learning more about how to create a policy brief packet or think about policy recommendations, I'd be happy to talk more. But some of the things I learned were that policy recommendation should be clearly targeting a person or an organization that has the power to enact or even just start thinking about these recommendations. Recommendations should be specific, very specific in request, and incorporate previous work that the person or organization you're asking has already done. So here, we know that the Office of Emergency Services has a California State Emergency Plan that they come out with every year. So how can we incorporate that previous work into our recommendations, building off of what they've already done? The recommendations should, of course, be reasonable and actionable and based on findings from research, whether it's community-based research, mixed methods, qualitative, quantitative research. They should be based in evidence. So I just wanted to, end on that note to share a little bit of the policy work that we've started doing, and I'm hoping that with this first experience under our belt, we can continue making policy briefs, policy recommendations on different topics, and as we expand our network, hopefully get these deliverables in front of people who are making these decisions and can really help us make a difference. And Rebecca, yes, this document is available. I'll be sure to. It's on our website right now, but I'll be sure to send it in the follow-up email as well.
Thanks. I think it had some useful language for us to start sharing in terms of the way we discuss things. So
yeah, absolutely. Yeah, I definitely learned a lot about language and policy recommendations and how to make them as specific and direct as possible. So we'd be happy to share that with you and talk through that with you more as well.
Okay, great, thanks.
Yeah, so I have the last thing I wanted to say is I have a feedback form link. I know we didn't have one from our second meeting, so I wanted to make sure for the last meeting of our year, any thoughts you have on how meetings are run, how they can be more beneficial for you, would love to hear them. It's been I know our first coalition meeting was in April, and this is the last one of the year, and it's been really great getting to work with you all, getting to know you all better. And I'm always looking for ways to improve this participation experience for you. So I would appreciate it if you had time throughout the day to fill that out. And again, I'm really grateful for your participation today. And I hope that you have a great holiday season, November and December. I can't believe we're already here, but I'm going to stay on the call for a little bit in case anyone wants to chat. But I hope you have a great rest of your day, and thank you again.